Welcome to Pindar Poetry. We hope you learned something new.
Confirm the medication is formulated for transdermal use before applying it to a cat. Read the label and any veterinary instructions thoroughly. Weigh your cat and confirm dose instructions, then measure the dose in a syringe. Wear nitrile gloves and work in a calm, well-lit area to prevent contamination and stress. Prepare a clean towel and a soft reward to calm your cat before and after application. Keep other pets and people away to avoid accidental exposure to the medication. Part the fur at the inner ear or inner thigh to expose about 1 square inch of skin. Hold your cat gently but securely, using a towel if needed to prevent sudden movement. Apply the measured dose from the syringe directly onto the exposed skin, avoiding contact with fur. Use a fingertip gloved in nitrile to gently rub the application site for about 10 seconds to spread the medication evenly. Do not bandage the area and avoid bathing for at least 12 hours after application. Keep the cat separate from other pets and children for at least 2 hours after application. Observe your cat for normal behavior changes and appetite for the next 24 hours. Monitor the site daily for redness, swelling, hair loss, or odor, and contact your veterinarian if changes occur. Wash hands again after glove removal and clean any surfaces that received accidental medication. Record the date, time, dose, and any reactions in a journal to show to your veterinarian at follow-up.
Thanks for watching. Consider subscribing if we helped you.